Hello, everybody. Welcome again. It's so nice that so many of you are joining us today for our open enrollment Zoom meeting. As I mentioned earlier, I'm sorry that we're not doing an in-person event. Obviously, it's not safe to do that. We don't want to put anybody in danger, but you know, I miss seeing all your faces. I do. I miss interacting with everybody. And I know it's always nice for the staff, for all of us to get out and see all of you. But we do get to see you virtually, and I'm sure you guys miss that as well. Not to mention all the raffle prizes and the food and the fun that we have. So we'll try to integrate some of that here today, though. You know, we've got to keep it interesting. But we are here to talk about Delta Dental today, and we're going to cover the LACERS updates for 2021, talk about our unique open enrollment period for this year, and then talk about LACER as well, and dive into a discussion on Delta Dental, after which you will have your questions answered. Now, mind you, we can answer questions about Delta Dental. We can't answer all philosophical questions, so, but we'll try. If you really want us to provide an answer, we will try. But yeah, so let's go ahead and talk about LACER's open enrollment and the benefits for 2021. All right, so as you're aware, this is our open enrollment period. And if you've been a retired LACERS member for a while, you know that typically our open enrollment period runs from October 15th to November 15th. This year, though, it's a very different year. I know it's different in so many ways, and so why shouldn't we be different as well? But we are extending open enrollment from November 15th all the way to March 31st. So open enrollment is actually going to run October 15th to March 31st. And that's going to give you a lot more time to consider your options, thoughtfully make decisions about your health plan choices. So I think that's a positive on that end. But you might be asking, why are we doing this? Is this a permanent change? This is not a permanent change. This is actually a response to budgetary issues that the city is facing and the resulting workload on staff. So you may or may not be aware, but the city is facing some budgetary issues, just like most other governmental agencies and various organizations and businesses due to the pandemic. And so in order to try to reduce their costs for this fiscal year and for the next fiscal year, they offered a retirement incentive program to those working employees that are already eligible for retirement but have not yet retired. So it was a pretty good incentive because nearly 1,400 people applied and were accepted for this incentive program and will be retiring over the next several months. Which sounds great, right? You know, lucky them, they get to retire and get a little bit of an incentive. But what that means for us at LACERS is we have a lot of job security because our workload is basically going to be tripling over the next several months. And open enrollment already increases our workload significantly during the period that we normally hold open enrollment. And so we thought, well, if we extend open enrollment for several months, instead of all these changes coming in a 1 month concentrated time period, maybe it'll be diluted over time and we won't have so much additional workload piled on top of the heavy workload that we're already facing. So really the goal is to still provide you the options, the opportunities to make changes, but also give us more time to process because we have such a heavy workload right now. So there are some restrictions that go along with this though, and I want to make sure everybody understands this. It's really important because it may affect the decisions that you make regarding this open enrollment. So the first thing to be aware of is that because of our heavy workload, when we get an open enrollment request, we are going to allow 3 months for staff to process that request. So if you submit your enrollment change or your new enrollment in February, we will have up to 3 months to process that. So that would be March, April, May. So we might process it in May, which means it will be effective in June. So We're going to do our very best to process all the requests as soon as possible. We're going to try to do it the first month as much as possible, but honestly, staff is so overwhelmed right now. We just want to give them space to be able to do the work. And we want to be able to set your expectations as well. And so if you already have coverage with LACERS, it's not like we're going to stop your coverage and you have to wait 3 months and then the coverage is going to pick up again. You're going to continue with the coverage you currently have until your change is effective. So again, we have up to 3 months to process your request. It may not take 3 months though. Also, you can only make one change during this open enrollment period. So if you submit your change in November, let's say, and we manage to process it by February, and you work with this new insurance company, this new plan, and then you decide, I don't like this plan. I like my other plan better. I want to go back. And then in March, you submit another enrollment change to go back. We will not honor that because you can only make one change during this open enrollment period. So even though it's extended, whatever change you make, you have to stick with. And it is important for you to understand that whatever change you do make, you have to stick with that change for at least 1 year. When the carriers develop their premiums, they look at utilization of the past and they project forward how much they think people are going to use their plan. They look at healthcare costs, and based on that, they determine what the cost for the next year is going to be, and then they come up with their premium. And so the goal is to really have people in the plans at least 1 year to cover the projected costs. So we don't want people jumping in and out of plans, which is probably why we do open enrollment every year. So people are in a plan for at least a year. So we want to honor that. So again, if you make a change, you have to stick with that for at least a year. And then honestly, you won't be able to make another change until the following open enrollment. So if you made a change that was effective in March, then you'd have to stick with that change until March of 2022, because that's a year, but it's not open enrollment yet. So really you have to wait until October of 2022 to make your change, which will be effective January 1 of 2023. So let me just repeat that. So basically, if you make a change that's not effective until after January 2021, you're not going to be able to make another change until open enrollment for the 2023 plan year, which will take place in October of 2022, and then will be effective January 2023. So it might essentially end up being more like a year and a half or nearly 2 years before you can see a change. Now, if you have a qualifying event, of course, we're going to honor that. If you move to a new location where your current health plan is not available, that will be a qualifying event to allow you to change plans. If you have a family status change, you can then add a dependent. And also, of course, when you become Medicare eligible, you can make a change. So definitely for those sorts of things, there's no restriction, but just for regular changing plans, adding a dependent situation, these restrictions will apply. Now, if you have any questions about this, I know it's probably a lot to absorb. Definitely put them in the chat and we will get to them during our question and answer session. But I hope you understand that we're not doing this to make life difficult for you, really. We want to serve you and want to make sure you're happy with your health plans. All right, so talking about our health plan renewals, it's very good news. The last few years, we've had an amazing streak of minimal increases, if increases at all. And for 2021, it's no different. Overall, the premium cost for our medical, dental, and vision plans is increasing by less than 1%. And it's way less than 1%. I mean, it's much closer to 0 than it is to 1. So it's pretty much remaining flat, which is really quite an achievement. And we're really happy about this, obviously. It helps manage our costs for the future, helps sustain our program. and allows us to continue offering comprehensive benefits. And the nice thing about that, even with no increases in cost, we're seeing additions of benefits and programs to our plans. And so it's nice to be able to offer that. In terms of Delta Dental specifically, the premiums will stay the same for 2021. So for the PPO plan, the single party premium is $51.16, and the two-party premium will remain at $101.45. For the HMO plan, Delta Care USA, the single party premium is $14.38, and the two-party premium will remain at $26.85. Of course, a lot of you don't pay the full premium because of all the years you worked with the city. You earned a subsidy, a dental subsidy. So that, for many of you, covers most of your cost, if not all. And I will talk about that now. So in terms of medical and dental subsidies, let's start with medical first. In case you're not aware of how the board decides what the maximum medical subsidy is each year, I'm going to go ahead and explain that. It's pretty simple, actually. So in the administrative code, it defines how the board can increase the maximum subsidy. And basically, it all depends on the Kaiser HMO non-Medicare two-party premium. The board can only increase the maximum medical subsidy by the amount of increase in the Kaiser two-party HMO premium. So if the premium for that plan increases by $100, then the board has the authority to increase the maximum medical subsidy by $100. For 2021, similar to Delta Dental, the Kaiser HMO premium is remaining the same. So the maximum medical subsidy will also remain the same at $1,790.80 a month, which is really good, right? I mean, that's a lot of money. So I know that covers a lot of our members' costs, and we're thrilled about that. Actually, when we look at the overall premiums that we spend on a monthly basis, and we look at the subsidy coverage that members have, it's well over 90%. Like it's around 93, 94, depends year to year, could be 95 or 96% even. So really overall, the membership, they pay less than 10% of our overall costs. And I think that's amazing. So for talking about the medical premium reimbursement program now, this program is for people that cannot access a LACER's HMO plan because of where they live. It's for people that cannot access an HMO plan in California, or they live outside of California within the United States. Anyways, that allows you to get your subsidy dollars reimbursed to you for a plan that you enroll in. And so the maximum reimbursement that you can receive is the same as our maximum medical subsidy. It's $1,790.80 a month. The dental subsidy now, so we're talking about Delta today, so this is more relevant, I guess, but it will remain the same at $44.60 a month. Again, the board can only increase the subsidy, the dental subsidy, by the amount that the city increases its dental subsidy for the employees. The city did not increase their dental subsidy, and they haven't for the last few years. So our board couldn't either. So the maximum subsidy will be $44.60 per month for the PPO plan. And because the total premium, which is a little bit less than the premium for the PPO plan, the single party premium, right? However, because the HMO premium, the full premium is less than that, we can provide full coverage of the HMO premium if you receive the maximum subsidy. So it will remain at $14.38 a month. Okay, hopefully that makes sense, and moving on. All right, so just some reminders about the health plans. If you're planning on moving in the future, please keep in mind that your plan that you're currently enrolled in may not be available in your new zip code. Okay, so we've had situations where members have stayed within their state but moved maybe to a more remote area, thinking that their current medical plan would be available in that new area. And unfortunately, it wasn't. And the only LACERS plans that were available were more expensive, and they hadn't budgeted for that. And it actually created a little bit of an issue for the members, and they were very upset. So if you're going to be moving, I just really encourage you to call LACERS to verify what plans are available in your new zip code, because obviously where you live is important, but I know your healthcare is also very important. And if it affects your budget, I know that might give you some reason to reconsider your options. So again, we're always here to help. If you are going to be changing plans, make sure you get your prescriptions filled before your new effective date, the effective date of your new plan, so that there's time for the new plan to upload all of your information into the system. Usually there isn't a problem, but you just never know with technology. And it's better that you just have some extra prescriptions on hand to get you through that transition period. And if you are changing plans and you know that your current doctor accepts the new plan, so if you're moving from, let's say, Kaiser to Anthem, well, no, that wouldn't work. If you're moving from, let's say, Anthem to Scan, and you know that your doctor accepts both insurances, you want to make sure that your doctor is still accepting new patients, because even if they're accepting the insurance that you're switching to, they may not be accepting new patients, which means you won't be able to see your regular doctor. So you'll want to talk to your doctor before you make that decision, if it's so important to you to keep the same doctor. Otherwise, you'll have to find a new one. And I know that can be challenging sometimes. And then just a reminder that if you will be turning 65 soon, we do have a Medicare requirement. You must enroll in Medicare Part B. You pay that out of pocket. Unless you receive a social security check, then they usually deduct it from that. So enroll in Medicare Part B. If you're eligible to receive Medicare Part A at no cost, you have to enroll in Medicare Part A as well. And if you have both Medicare Parts A and B, you will be reimbursed the basic premium for Part B, which is the one you pay out of pocket for. But we do not reimburse any late enrollment penalties for Part B or any income-related monthly adjustment amounts. So there's, based on how much income you make in a year, there may be some additional premium charges that you pay. We only pay the base, we only reimburse the basic premium. Okay. Also, if you have moved or you changed phone numbers or have a new email address, please let us know. It's very important that we have your contact information. You never know when there's some important information, like we need to give you $10,000. We want to be able to reach you. And it's also good to review your beneficiaries, make sure that who you have on file is who you want to have on file. Things change over time and we forget to make changes at LACERS. So just review your beneficiaries. If you need to make a change, we do have a form to do so online, as well as a change of address form. And I just want to take a moment to talk about power of attorney. Anything can happen to any of us at any time. A lot of the times when we think about having a power of attorney, I think what comes to mind is that you're very old, you're maybe in a weakened state, maybe you're dealing with some dementia or something like that. And so you need to have somebody there to make decisions. But, honestly, anything can happen to any of us. I mean, their car accident, whatever, right? And so you just want to make sure there's someone that you trust that's assigned to make healthcare decisions for you. And there are different kinds of powers of attorney. So you want to make sure that you have one for your health benefits. And so really think about that and look into it. And I know at LACERS, we do have some power of attorney forms as well. And you can find that on our website, which I'll take you to in a moment. We do have a couple, well, we only have one more actually, open enrollment meeting following this one. Anthem Blueview, the vision plan for anybody enrolled in Anthem, Scan, or United Healthcare. That will be on Monday. If you haven't registered already, you can register through My Lacers, or you can call Lacers and they will get you set up. And if you weren't able to attend one of our meetings, they will be posted on our website. We are recording. Right now, we're all recording. So we're about to post the previous meetings, so that those will probably be up by next week. So you can revisit if you miss seeing my face and hearing my presentation, or anybody else's for that matter. We will be, you can see us over and over again. And of course, if you just want to hear something again for more clarity, it'll give you that opportunity. Okay. So everything you need to know about your LACERS health benefits and about open enrollment is available on our website, www.lacers.org. We have all kinds of information, and I'm just going to take a moment really quick to take you to our website in case you haven't been there, and just show you exactly where you need to go and how to get there to find some of the useful information. Right. So this is our website. I don't know if you've all been to it lately or not, but we have revamped it in the last year. So it might look different if you haven't been there in a while. But this is our homepage, a lot of really good information. First, I did mention forms to update us on your contact information or to change your beneficiary. Also, in terms of health plan enrollment, if you just come here to the top, here you'll see forms and info sheets. You just click on that. And it will take you to a page that has all kinds of fun forms. Change of address form, direct deposit. If you're not doing direct deposit, I highly recommend it, although I believe the vast majority of our members are doing that. Domestic partnership forms, and here are the health benefit forms. So medical plan enrollment, dental plan enrollment, family account change forms. So if you're making any changes, this is where you can find some of the forms. Also, here's some power of attorney forms and information as well. So it's really good to check this out. And then in terms of open enrollment and information about your health plan carrier options, go back over here to retirees. You can come down here to health benefits, or you can just click on retirees, which I'll do. I'll go the long route, scenic route. All right, and so then you can click on retiree health benefits. And what should show up is open enrollment, and there it is. So you click on open enrollment, and we put all sorts of information for you. There's another video here basically covering what I covered earlier. Talks about how we're doing open enrollment this year. If you accidentally threw out your open enrollment package, who would do that? You can actually see the overview right here, and the health benefits guide is also right here. And then just some FAQs about open enrollment is right there. We've got the meeting dates here, but we're towards the end, as we mentioned earlier. And then this is a really good section here, the health carrier plans and benefits. So if you're really thinking about changing plans and you want to know more about each carrier, you click here, and it will take you to another page. And then on that page, we have all kinds of information from each of our carriers. So from Anthem Blue Cross, we've got some presentations and flyers, Anthem Blue View as well, Delta Dental right here. So it'll take you to the website. There's a great little video about Delta Dental, benefit highlights, Kaiser, Scan, United. So really, it gives you a little bit more information to just, really think about your options. We just want to make sure, because we're not able to see you as often in person, and we wanted to make sure you had more information available at your fingertips. So again, if you're thinking about changing plans, then that's where you'll want to go. And I'm going to go back to my original presentation now. So let me switch screens. Feel a little bit like a ping pong ball. All right. So now I'm just going to quickly mention something about Lacers Well and then kick it over to our Lacers Well team to tell you more. But basically, Lacers Well is our wellness program. It has all kinds of wonderful activities and events. We were doing a lot of in-person things. The pandemic changed a lot, but we are looking at a lot more virtual events and trying to develop more. And so if you have some ideas, please, please, please share it with us. But I don't want to steal anybody's thunder. So with that, I'm going to hand it over to Stephanie Smith, who oversees the wellness program and works with Crystal Baldwin. And she is going to tell you more about Lacers Well. So thank you very much.
Thank you so much, Alex. Wonderful presentation. And thank you all for joining us for the Delta Dental open enrollment meeting this morning. We do have a wellness video we want to share with you. We're really proud of it. It walks you through some wonderful programs that are available to you as a Lacers Well member. But before we get to that video, I wanted to share some virtual activities we're working on and for you, and Crystal will be sharing some activities as well. So the holidays are coming up, and I know this is can be a difficult time. So with the pandemic, you have a double, worry of those that have lost loved ones and maybe missing their loved ones. So this workshop, we've designed this workshop to help with some coping strategies. And so I'm really looking forward to that workshop and hope that you can join us for that. It's on November 18th. And you can check your Lacers Well email or our website, and you can register for that holiday wellness workshop via my Lacers account. If you're not getting any emails from Lacers, please check your spam folder because we have had some members say that they haven't been receiving emails from us or missing emails from us. So please check your spam folder. We don't want you to miss out on anything that we have available to you. So hope to see you at our next virtual wellness event on November 18th. And now I'll pass it over to Crystal to tell you about some additional program events that we have for you, as well as our champion program. Crystal?
Hey, everybody. It's good to see you. Hey, Bernadette, I see you. It's so good to be with you this morning. And I'm responsible for recruiting retired members to the champion program to actually lead an activity. So as Stephanie stated previously, we had champions that led walks on the beach, walks in the park, mall walks. We have champions that lead line dancing classes, cooking classes, museum tours, and so forth. But as Stephanie and Alex both stated, when the pandemic hit, a lot of those things we had to stop for safety reasons. And so spearheaded by Stephanie Smith, we started the volunteer phone bank, and there's a few of you on here that volunteer for that currently. We definitely appreciate your help and your service with that. Basically, this program have retired champions to reach out to our older retiree population, and I'm talking about our members that are over 85 and higher. And during the pandemic, and still currently, we call the champions to check on them, provide them with important resources like grocery deliveries, assistance with needing to obtain medications and things of that sort. So that program is still in operation right now. We've also partnered with an organization called Element 3, which will be assisting us with facilitating our virtual book clubs, movie review clubs, and scavenger hunt games. We're also in the process, and some of you here has already volunteered to assist with that. We're planning a holiday social gathering, sort of like a holiday party after Thanksgiving. We're working on getting that coordinated and established now for our retirees who may not have been able to get with family during the holidays and so forth. So we are really excited about what we're doing, even virtually. And so we look forward to some of you all volunteering. If you have a skill, a hobby, something that you enjoy doing, and you want to share that gift that you have with others and lead an activity, we will help you with coordinating it and getting it facilitated. and other retirees, because we have members who golf and do other things. And so we will help to get that activity going. So we have a beautiful video that's been put together that's going to explain things a little more in detail. And I'm going to turn it over. I believe, Elijah, you're going to start our video, and over to you at this time.
Well, my name is Alex Rabrenovich. I oversee the Health Benefits and Wellness Division at Lacers. Lacers Well is part of that division, and so I, along with Stephanie Smith and Crystal Baldwin, plan and strategize to bring wellness opportunities to our retirees.
My name is Stephanie Smith, and I'm a wellness program manager with the Lacers Well program. And my role is to oversee the daily operations of the wellness program.
This is Crystal Baldwin, and I am the Lacers Well Champion Coordinator. And my role as the Champion Coordinator is to recruit Lacers retired members to the Champion program.
So over the last few years, we've really come to realize what we want to achieve with our wellness program. Initially, we wanted to educate people about avoiding chronic conditions and staying physically active and eating well. But we realized people already know about that. People hear about that from their medical providers, from their friends, on the TV. And as we started doing more research on wellness, we realized that there's a lot more to well-being. There's a lot more different factors that play into somebody feeling well and being well. So there are 5 components to overall well-being. One is purpose, there's health, mental and physical, financial well-being, social engagement, and community. And we realized that purpose is a real driver. If you have a sense of purpose, you want to get up in the morning. You want to be well. You want to live. If you don't have a sense of purpose, you might not be willing to take care of yourself, because what's the point? You know, why am I here? Why should I do anything? And so we really wanted to start to work more with that in mind, sort of building a sense of purpose in people's lives and also giving them opportunities to expand their experiences in the other areas of well-being. Last year we did something called the Purposeful Living Workshop. It was a 5-session workshop that focused on each component of purposeful living. Again, that's purpose, health, financial wellness, community, and social engagement. We're really fortunate in that we have a good partnership with the Department of Aging with the City of Los Angeles, and they let us know about a program called Aging Mastery Program that's sponsored by the National Council on Aging. And it's a 10-session program that covers the same areas. I mean, it's not specifically titled the way we titled our sessions in the workshop, but it covers all the same areas, and it's a fantastic program, and we're so happy to be able to bring that to our members. And so that's something that we're just starting this year, and I know people are going to love it. And we look forward to other workshops that we can bring in the future, but this is really an opportunity for people to really sit down, examine their lives, examine their goals, and set up a plan to achieve their goals. So we're really fortunate again to have a partnership with Mom's Computer. You know, it's a small company, but a very passionate group of people that really want to help seniors with technology. They have joined us at some of our events to help members with any questions that they had about how to use their smartphone, their laptops, their tablets, and they were a raving success. People were coming to our events with their equipment, sitting with them, getting advice, and the more feedback we got from people, the more we realized they really needed this help. And so we've taken it a step further, and now we have them on retainer so that not only are they at all of our events and helping us with our virtual sessions, but also they're available to members anytime. If they have a question, they have a problem, they need help, they can just reach out and call them and get assistance. So a couple years ago, we started what we call our volunteer picnic. It's an opportunity for people to come together, have a good time, you know, be outside, have live music, eat a nice lunch, But also there's a volunteer component to it. We invite various volunteer organizations to come and set up booths so that members can then walk around and get to see the different opportunities that they have to volunteer in their community and give back and engage with their community. Again, that supports that whole purposeful living campaign. So we have a gala at the end of every year, or I guess at the beginning, depending. But basically it's a way to celebrate the year that just passed. It's a big party basically for everybody that participated in our program. We have dancing, we have food, we have performances, we have prizes. People love it. And you know, it's funny because I think people have, you know, an image in their head of what seniors are like and retirees, and you know, you don't think they're going to get down. They were on the floor dancing, doing all kinds of dances that I didn't even know existed. And these are current dances, okay? So I was out there with them too, having a good time. And I'll tell you, the next year it happened again. And then unfortunately, because of some budget issues, we couldn't do it the following year. And people were upset. They want to dance. So we're going to be coming back with a big dance party and celebrate again. So that's probably my favorite thing that we do. It's just about having fun, social engagement, community. Love it. So we started a Facebook page not that long ago. And really it's a way for members to connect, see what's happening online. Some people are more remote than others. They don't necessarily have the ability to come to all of our events. Maybe they don't really come to our website, but they are on Facebook. So, you know, they can check in on our Facebook page, see what we have coming up. There's a lot of good information, wellness-related information that we post, videos, articles. And again, it's a way for people to connect with each other and, you know, just stay in touch and support wellness. So our wellness newsletter is called Your Health Matters, and it's focused on the topic of wellness, also focused on our 5 principles of well-being. So it's really just a way to encourage members to continue thinking about and engaging in those 5 elements of well-being. Also, it connects them to the different resources available through our health plan carriers, and lets them know about upcoming events. It's a way for them to stay informed and stay engaged. On the Lacers Well page, you can learn about different activities. You can register for upcoming events. If you've participated in our events, again, you can earn points through our Passport to Health program, so you can go ahead and log those points on our website. There's a calendar that shows all of the upcoming events, so if you're not sure what you might want to do next month, you can look and, you know, and there you go, you have some options there. It's really a great way to stay connected. So with the pandemic of 2019 and 2020, we've had to really make a big change. We had so much focus on in-person gatherings because to us the social connection is so important. And we couldn't do that anymore, so we didn't know what the next step was going to be. Although we know there are, you know, different ways that you can connect virtually, such as through Skype or FaceTime or Zoom. We weren't there yet as an organization, but we had to move quickly because we wanted to continue having offerings for people. We wanted to make sure the momentum continued with those engaged members, and we wanted to also attract and bring in more members. So we quickly switched over to virtual offerings. You know, it was a little bit of a quick bumpy road to get there, but we got there fast, and you know what? The members loved it. We had so much response to our first virtual event. We did a really great financial resilience workshop. It was a 3-session workshop, and we had huge attendance and people from out of state and even out of country that registered, and that wouldn't have been possible before. And so it's really opened up the door to so many more of our members, and we're so happy we finally made it to this place where we can actually connect with people virtually. And again, it might not be something some of our retired members are really familiar with or comfortable with, but we do have that wonderful support of Mom's Computer. So if anybody out there really wants to join, but they're not sure how to participate in a virtual event, we have Mom's Computer there to help them. So excited about this program. You know, it's really grown a lot in the last few years, and we've got an amazing, committed team. It's a small but mighty team that really pushes this wellness program forward. We talk a lot about purposeful living for our members, but I think for us, it also provides purpose. You know, we really just want people to have the best retirement possible, and knowing that we're helping people achieve that not only feels good for us, but I know the members also appreciate it as well. And I just can't wait to see where it goes in the future.
Well, let's give it up to Alice to start our video. That was a great and very informative video. And we want you all to please hang on to the end until after the question and answer. We do have a raffle prize that we will be giving out at the end as well. But we are so grateful to have with us a wonderful representative from Delta Dental at this time that will be presenting the benefits that they offer for the HMO and the PPO plan. Let's give a virtual hand clap for Julie Manoia at this time.
Thank you. Thank you, Crystal. Good day, everyone. And I also applaud that video. That was really, really nice. I enjoyed it. What a wonderful thing that you all do for your people. I was really touched watching that. It's really nice. I really enjoyed it. So good day to everybody. I saw we had somebody from Idaho earlier in the chat. So I'm going to say good day because we all might be in different time zones. I'm here in Southern California. So thank you all for joining. I really appreciate you guys coming on to this virtual meeting and taking an interest in your benefits and your open enrollment. It is definitely that time of year. I have the same thing going on at Delta Dental with my open enrollment. So I do have a presentation that I will share my screen and set up with you. We're going to go over some dental health, which is always important for all of us. And then at the end of that presentation, I do have some information on your plans. So I did see some questions in the chat that may have been answered by the team. If not, hopefully the presentation, when we get to the end with the difference on your plans, the PPO versus the dental HMO, will answer some of those questions if they have not been addressed. Okay, so I'm going to just give me 1 second. I'm going to go off video during the presentation only because I'm working off of 2 screens here. It's just easier for me, and I don't want to be looking this way when I should be looking this way, but I'm going to have the presentation on a different screen. I don't want to look awkward, so I'm going to take myself off video. Any questions, put them in the chat. We'll hopefully address them. The team will hopefully address them as we go through it. If not, we'll get to them afterwards. So take myself off video here. This is the dental health portion in the beginning. So we're going to talk about obviously some good dental health and how you can keep your health for a lifetime, which is obviously important. So we do face a lot of dental risks as we get older. You wouldn't actually think that cavities affect us as we get older. They're not just for kids. According to the CDC, nearly 1/3 of adults ages 20 to 44 have untreated tooth decay. To make sure you're not one of them, visit the dentist for regular exams to catch those cavities. I myself haven't had one in quite a while, but believe it or not, they can happen. Gum disease, probably one of the larger things that we face as we age. If your teeth, if your gums bleed when you floss, definitely an indicator that there is an issue. So you do want to floss every day to improve your gum health. Also eat a diet rich in vitamin C, which does support healthy gums. Dry mouth really can be irritating. A couple things cause that. Certain medications, I know that I've experienced that. And it also can be just a simple side effect of aging, believe it or not. Purpose of saliva is to wash away food particles and harmful bacteria. So if you don't have enough saliva, you're at a higher risk of cavities and gum disease. So try and drink enough water throughout the day and choose sugar-free gum if needed to help produce saliva. If it's still an issue, talk to your dentist. Okay, dental hygiene can decline as we age. One of the culprits is arthritis. If you have an issue brushing or flossing, I found myself using a battery operated or a power toothbrush really can help versus a manual toothbrush. Okay, how can you maintain a healthy mouth? The top 2 dental problems: gum disease. It does affect half of adults. Tooth decay, most prevalent chronic disease in children and adults. Top 2 ways to prevent that: brush at least twice a day and floss every day. I find flossing for me is most important. Eat a balanced diet, visit your dentist regularly. Why should you get a dental cleaning? You're actually allowed 2 regular cleanings per year on both of your plans, whether it's the PPO or the dental HMO. Obviously, to prevent cavities, your dental hygienist is going to go in there and clean those teeth well. It's going to stop tooth loss, plaque and tartar build up, and you're more likely to develop gum disease and tooth decay. Brighten your smile. There is a reason when you go in and get that cleaning for that polish that they put on there. I have to say that's my least favorite part of a dental cleaning is the polishing, but it does brighten those teeth, freshen your breath. A dental cleaning does actually do that. And to boost your overall health. Studies have shown that regular cleanings may help lower your risk for heart disease. Why get a dental exam? Believe it or not, going to the dentist can actually identify any dental problems earlier. They're not just looking at your teeth. They can identify other health issues. It's a good screening for oral cancer, and they can also find symptoms of other diseases. What type of things can they find in the mouth? Believe it or not, dry mouth, a burning tongue, mouth lesions, gum disease can be symptoms of diabetes. That's one of the #1 things that dentists can diagnose. Another thing is heart disease, sore and painful jaw. Having gum disease can also increase your risk of heart attack. That's another thing that dentists can diagnose. Acid reflux, tooth enamel is worn down, especially on the back of the teeth. So lots of conditions that your dentist can find if that's the only person that you may be seeing in a year. So important to get into the dentist, and they can notice some of those symptoms. Your body and your mouth, the far-reaching impact of oral health. Taking care of your mouth can go a long way in protecting your health. Gum disease can make some of these system conditions worse. Diabetes, rheumatoid arthritis, glaucoma, heart disease. Not treating gum disease makes coronary disease worse. Diabetes. Diabetics with gum disease may experience a weakened ability to control blood sugar. Lots of important things are tied in to dental health and things that go on in your body. So again, very important to take care of your mouth. Invest in preventive care. We have a poster, it's not in here, but it talks about the cost of a cavity that can go on if you don't take care of that cavity. And that cavity starts with going in for cleanings and exams. Okay, preventive care is free on your plan. Okay, so you pay little to nothing for cleanings and exams. See your dentist regularly. So there's no excuses not to get your checkups. Regular visits do prevent issues. And by doing that, you save money by preventing costly and expensive procedures, not only a filling that can lead to a root canal and that can lead to a crown. And those are much more costly procedures than just going in for a cleaning and an exam. So that does segue right into what your plan options are through LACERS. Oops, I'm sorry about that. I went a little too fast. You have a Delta Dental PPO plan, and you have a Delta Care USA HMO plan. Okay, so those are your two options. What's the difference? I saw that question come up in chat earlier. With the PPO plan, you can go to any dentist. That's going to give you freedom to choose any provider, but you're going to save money by staying in network and using a PPO dentist. You're going to pay an amount, a percentage for the service that you have done. Delta's going to pay a percentage also. You're going to have a deductible and a maximum on the PPO plan. So you're going to have an annual maximum that is the most, that Delta will cover. On the Delta Care USA plan, you're going to have to choose and use a primary care dentist. You're going to have a set copayment for each procedure, and you'll have no deductible and no annual maximum. Okay. On the PPO plan, I did say you want to use a PPO dentist. You can also use a Delta Premier provider. Those are dentists that are contracted with us also. They just don't have the deep discounts that the PPO dentist has. You can also go to a non-Delta dental provider. You just may have to pay up front, and you're not going to have those discounts that the PPO and Premier providers have. This is a great example on the PPO plan of how you save money for a crown as used as an example. Submitted as a $1,200 fee for PPO. It's approved at certain fees, $750 for PPO, $950 for Premier. Plan would pay at 50% for a crown, $375 under PPO, and you would pay $375 for PPO. And it would go higher using a Premier provider. And of course, you would pay a lot more going to a non-Delta dentist. So these are just for example purposes only. Just as an example to show you how you can save money going to a PPO provider on the PPO plan. Maximums on the PPO plan, $2,000 per person if you go in network. So using a PPO provider, you're going to have more maximum. $1,250 if you use an out-of-network dentist. You do have a deductible. Okay, so the first $25 out of pocket before your benefits kick in, going in network, $75 per family. That is waived for your diagnostic and preventive services. So if you're only going in for your cleanings, x-rays, and exams, you don't have to pay that deductible. And then you do have ortho covered on this plan at $1,500 per person, and that's a lifetime maximum. So that's a one-time payment. And take a closer look at your PPO coverage. The services on the left are sort of a high overview of what they are. Cleanings, x-rays, exams, fillings, etc., fall under basic. Your major services, which are your crowns, etc., prosthodontic bridges, and ortho, are covered for dependent children only. And those are the percentages that Delta pays. So if you went in for a root canal under basic services using a PPO provider, Delta would pay 80%, you would pay 20%, and Delta pays 80% up to that $2,000 annual maximum. If you go out of network, you can see that the percentages that Delta pays for those top two categories does fall down percentage-wise. So you're going to be responsible for more using an out-of-network dentist. And then in addition, those out-of-network dentist fees are going to be higher. So definitely to your advantage to use a PPO provider, lower fees by the dentist, and you'll get that higher annual maximum. To your advantage to use our cost estimator, you can go online. Oops, I'm sorry, let me go back. Go online, get a personalized cost estimate. You can plug in your dentist's name, put in the procedure, and it will tell you how much out of pocket you would be estimated to pay and how much we would pay to your provider. And you can also compare costs. Put in a different zip code, put in a different city, see how much a different dentist fee would be. Very nice sorry, very nice tool that you can use. A quick overview of the Delta Care USA HMO plan, which is, remember, is the plan where you have to choose and use a dentist off of a more restrictive list. You don't have the freedom to go to any dentist. It's actually going to offer you sort of more bang for your buck, because you're going to have set co-payments. So you're going to know upfront what your out-of-pocket cost is going to be. No maximum, no deductible. You do get coverage for emergency care, up to $100. And I did see the question pop up in chat for emergency care also. So on the Delta Care USA, if you're out of area, you basically get emergency care up to $100. And it's basically to sort of get yourself out of pain taken care of. If you're on the PPO plan and you're traveling, because you can go to any dentist, you could go in and get services rendered, and you may have to pay for it depending on where you're at, but you could basically have service done using the PPO plan. The Delta Care is a little bit more restrictive because you do have to get your care done by the dentist that you're assigned to. But if you're traveling and you have an emergency, you could see a dentist and basically get yourself out of that emergency situation. You need a referral to a specialist on the Delta Care plan, and that is arranged by your primary care dentist. And remember, on the Delta Care USA plan, you do have to select a dentist, and that's who you're going to go to for your care. One thing to keep in mind is that you're never locked into that dentist that you choose. You can always switch to another dentist. It's a simple phone call to our customer service by the 15th of the month. By the 1st of the next month, they will have you transferred into the new office that you choose. Some of the highlights of the plan, and you can see where it is advantageous to be on this plan, because no cost for the exam, cleaning, filling, and then looking at just cost of a crown, your co-payments would certainly be a lot lower on the Delta Care USA plan. So lower costs on the HMO plan. However, remember, you have to choose and use a dentist on the list. Some value added benefits, and these were added last year to our plan, and these are nothing new. We do have Amplifon, which is a discount on hearing aids, 62% average savings. All you have to do is call this number and they will set you up with a provider in your area. I think that's a great discount. And Call Site, which is discount on LASIK eye surgery. Again, 40 to 50% on the national average price. So that is a number that you can call also, and they will refer you to providers in your area. So that is, all you have to do is tell them that you are part of, sorry about that, Delta Dental. That is all you need to do on that, and that is a discount program. You can contact Delta 24/7 for our automated system, and then our hours for Pacific Standard Time are listed here also. And that is the end of that. And I will take a look at what's in chat, and if we need to.
Yeah. Hi, thank you. Yeah, I was with a very beloved dentist under the non-PPO plan, and he retired. So I am very strongly considering going to the PPO. So I will be picking a dentist from among your pre-selected dentists, right?
Oh, so the HMO plan, you're thinking of?
No, no, not HMO.
Okay, so you're on PPO. You're going to stay on PPO then.
Right, but
Okay.
I'm on non-PPO, where I selected a dentist that isn't part of your network.
Oh, I see. So you've been seeing an out-of-network dentist.
Okay.
Yes.
Okay. Got it.
And now I'm going to switch to an in-network dentist.
Okay.
But
Got it.
okay, thanks. So I have a kind of overwhelming how do I start even to find that? One thing I guess I want to know is, are all your dentists members of and approved of the American Dental Association? And how do I know about a dentist's qualifications and background, and how do I start finding
Yeah.
one?
May I share my screen again? I'm going to go to our website.
Please go right ahead.
Yep, I've already got it booted up here. Okay, so everybody can see it, right?
Yes.
This is our new and improved website. So you want to go to, hold on, find a dentist right here. And when it comes up, I got to move myself out of the way here. So you want to, I'm just going to put myself in here to make it easy. I live right here in Anaheim. Your network comes up. So you want to try and find a PPO provider. So you're going to pick PPO. Find a dentist, and it's going to give you a ton. You can change the radius. Okay, I don't know what radius I had up here, but you can refine the search by distance. Oops, sorry, shouldn't have done that. You can refine it by their specialty, their extended office hours, etc. So I put in 60 miles. I've got a lot of dentists to choose from, but it brings up the closest one first. And then the nice thing about these is they have Yelp reviews. So that's going to probably be your best starting point if you don't know anything about any of these dentists. I don't know where you live, Susan. Are you out of state? Are you in?
No, I'm in Hollywood. I'm right. And I've already done just what you're describing. I've gotten this far. I had a really lot of dentists very close by.
Yeah.
And I could see what languages they spoke, which was handy. But I still don't. And I also saw that there were Yelp reviews.
Yeah.
But those are not professional reviews. I mean,
they're not. No. All of these dentists with us, of course, belong to the ADA. They're all, oops, that didn't get me there. They're all, of course, have to be screened. They all have to meet certain criteria. They otherwise they're not part of our network.
What are those criteria? What is the screening?
Well, there's a gigantic contract licensing that they have to go through. I couldn't even tell you what it is, to tell you the truth. But we just don't take anybody. They have to meet certain, all sorts of things. But do you have anybody that, neighbors, friends that you could ask? That's how I've always found my dentist.
Well, no, I was hoping that Delta would have some more specific help in identifying dentist specialties, how long he's been, in service. I was looking for something that was not so colloquial.
Yeah, well, unfortunately, I mean, we have to just kind of provide the basic information, and then I think, unfortunately, it's up to you. We can't recommend one dentist over another. That would really not be fair.
I'm sorry, is there a website people can go to somewhere, whether it's the ADA or some other organization's website, where you can see if there have been claims made against a dentist or something?
Thank you, Alex. That's really good. Thank you.
There is.
I don't know if you can do that on the ADA, but I would think you could probably do it on Better Business Bureau or something like that. I mean, ADA is something that they belong to. That's the.
I definitely. Oh, go ahead, Crystal. Sorry.
No, I was going to basically say, because I've done the same thing that she's talking about and I do it with my doctors as well. You can just Google the doctors or the dentist names, and there's a bunch of, you can pull up their bios, where they went to school, all of that stuff. And then there's a particular website where, because everybody that has a license in California to practice, whether it's law, medicine, even with professional people I deal with, I will run their license number and it'll see if their license is suspended. It'll say if there's been any complaints against them. So you can just basically Google the dentist name, I used to tell retirees, go to if you see a dental office online or in the directory, go to the dental office in person.
Yeah.
You can go check the office out in person, see if they have modern equipment,
Yep.
the modern amenities is what I would always tell them to do, because I was a health advocate. So I would tell them, go check the dental office out in person first, see if you like the aesthetics of the place. If you like the way it's set up and they got modern computer and technology, then you do your research on the dentist. And it's a lot of stuff online. Basically, Google the name, and then there is the website, and I can't even think of it right now, but I can probably put it in the chat, where you can run their license number, and it'll say if it's ever been suspended and things of that
Okay,
sort.
so thank you, Crystal. This is really useful. But I guess my question is, shouldn't Delta be screening these things if dentists have complaints, if there are problems, so that each one of us doesn't have to go traipsing around the neighborhood visiting these dental offices and Googling their license. It's like, I want more to know if there's more of a overall screening already happened.
But I was gonna say they actually do that, because I used to work, members would call me and have complaints about dental offices and things like that. Delta actually does have a way that they will investigate a dental office if there's issues going on with the dentist.
Yeah.
And I've heard of dentists actually being dropped from their network if there's an issue and a complaint. Then they won't be a part of Delta's network. They will no longer keep that dentist connected with them. So no, Delta does have a way that they screen and will look into complaints and customer quality of care issues and things like that. Because I know I've dealt with it in the past.
Right.
Yeah.
But we're not going to put it. Unfortunately, we can't put it on our website. We can't. I think we'd be sued for slander and libel. Unfortunately, we would just, if we get I'm sure if we get a certain amount of complaints, obviously if the dentist loses their license, then they're gone. And if we get a certain amount of complaints or something, then they would drop off of our network also. Yes.
Thank you.
Yeah.
Yeah, I sympathize with you. I just helped my parents find a dentist, and just trying to find one that I looked up reviews. I tried to find wherever I could, and it's hard because they're in your mouth. It's very intimate, So I understand what you're going through.
Thank you.
As do I. I moved to a new area myself and still haven't found a new dentist, so I understand. Yeah,
maybe,
I know.
Maybe the message to Delta is help us out a little bit more here.
And yeah, unfortunately, we just can't play favorites. That's the issue. That's all.
No, not to play favorites, but to give us some of the criteria that you're screened for, and how that, the fact that this dentist has passed this screening and this screening, or these specialties, or these, that is kind of what I'm looking for.
Yeah.
All right.
And I don't think that's on our website. I'm sorry.
Okay.
Thank you. Great discussion. I'm learning a lot here. Next,
before we go on to the next one, Elijah, I just put in some links to what Crystal referred to, the dentist license search. I put in the link there. And then I did locate on the Delta Dental site their credentialing process on what they look for.
Thank you.
Their dentists.
Great.
right there on the chat screen. And that'll also be available to everybody after the meeting. So it's hard to write down all those things, but that'll be disseminated to you by Lacers. Our next questioner is Doggy Dell. Here we have a real name, Doggy Dell. Are you with us, Doggy Dell?
I see her.
Yes, I am. Here I am. Here I am.
Please go right ahead.
Okay. Of course, I have a dog that's barking right when you want me to ask a question.
Okay.
She wants to go outside. Do you want to come? Okay.
No, it's fine.
Hopefully she'll. Okay, I have two questions, or I have the claim forms right here. Last year I was with the HMO. I'm 61. I've only had one cavity in my entire life. And then they came up with another cavity and they tried to tell me about bleaching and all that stuff, and I didn't want that. But they also, when I called Delta Dental, it turns out that this particular dentist that I had chosen has never put in a claim at all for me. And they said anytime they do any procedures at all on you, they're supposed to file a claim. So that, stop it, Taffy. That was one issue that I wanted to know. I think, you know, I didn't want to go back to them to have a filling. There was a problem with my filling. My filling cracked. It had only been, we looked it up, it had only been 2 years, and they had put in a metal filling, and the metal filling cracked, and then there was a huge hole in it because I went to and paid out of pocket for the PPO dentist to look, and because I kept feeling something, and food kept getting stuck in there, and I didn't know why. And then he said, look, and he did a special thing to show me. Anyway, so I wanted to know, now Delta Dental called while I was on hold and told them they need to file claims. And so now they said, well, wait a while, which it's been 2 weeks or 3 weeks. And they said, I should call the dentist back again and have them file the claims, but I would rather have Delta Dental follow up on it. Should I call again and see, you know, I'm just trying to stop. I just want to be able to have a clarification. I mean, they charged me like even a lot of money just to get my handwritten, just to get notes on my file. So
Are you on, you said you're on the HMO plan?
no, I was last year. I
Okay,
had a
but now you're on the,
time getting through on your phone number. I mean, I went through, and then they were able to transfer me. Evidently, there's no number that you can call directly if you have a question for Delta Dental HMO that you were on. Your name keeps coming up as, no, I was under PPO now, and I had a question about when I was on HMO last year. And so you have to call Delta Dental, and then they automatically see, no, it's PPO. I had to go through the PPO, then I had to wait, and then they had to transfer me physically. They said there's no particular number that I can call, because anytime I called the HMO, it saw I was PPO currently. And
but
so,
who do you need to file the claim under, HMO or PPO?
no, the HMO. But
Okay.
I also have a question. Don't get rid of me. I
No,
also
no.
have a question about the PPO.
So
But
if the claim was under the HMO, I think
the
you
claim
need,
under the HMO, I just want to know, they never made any claims at all. I don't have any paperwork. And they said anytime you do a procedure, they have to file claims. So
yeah, for the HMO, you just should have paid a co-payment probably, and there's really no claim filing on the HMO. So I'm a
yeah,
little
but
bit.
I don't, yeah, and I don't think I paid. I mean, they did a regular filling. They should
Yeah.
have had a claim. If they did a filling, that's not just a co-payment, right?
It is just a co-payment, so there should be no claim. That's where I'm.
Okay, what if they, and if they did x-rays and all that?
It's just a co-payment. No,
Okay,
there's no claim.
but if I wanted to see documentation on everything they did, and they only gave me like half a sheet and charged me, you know, $59 or something like that, just for a half written sheet. So, but I did, okay. I didn't realize that they don't have any claims at all or anything. They were gonna go back. Okay.
Yeah, I'm not quite sure if anybody on the team, maybe we could get this woman's information and take it offline. This sounds like something we need to have Kristen Warren help with.
Yeah, I think that's also something that, you know, based on what knowledge I do have, it might be that you have to deal with the individual dentist on the information, because, you know, as Julie was mentioning, with an HMO, you pay a copay, they handle the service, that's
Yeah.
it. They don't file a claim.
No, they don't.
With Delta for that. So, you know, that might be just in your dentist's office. And if they don't have anything, then that's on them.
Yeah.
What I do want to add is that LACERs have health advocates, because I was one of them. And V is on here, and maybe V can get your information.
Yeah.
Because I know that a lot of the times our members, when it comes down to dealing with these dental offices, even the medical providers, you will get the runaround. Yep. Okay, and so that I know. So basically what the LACERs health advocate will do is, you would submit the claims to us. I mean, we would interact and do things to assist you with getting the issue resolved. Okay, because I know how they will do. So what you may want to do is, and V is on here, he can get your information. We can contact you offline as stated, and someone can get back with you and get that information, because we have health advocates to help members resolve these type of claim issues and make sure stuff get processed.
Yeah.
And follow through, because yeah, you shouldn't have gotten a bill and things like that with regards to the HMO. Okay.
Okay, now I have a separate question. Now I'm on a PPO, okay? I had my very first root canal and crown. The root canal, there's something on my claim here that says that this service, that I never had a root canal before. This particular endodontist did a special, like he had a special treatment or something through anesthesia that really helped me and really made me feel very comfortable, and I didn't have any trouble at all. But they said it might not be covered. So I wanted to know why it's called cone beam CT capture interpretation with a field of view of both jaws. And that to me seemed like it would be, you know, it should be covered. It was $200. And stop it, Tavi. It was $200. And so I had to pay the whole thing, pay the $200. And for the whole root canal, it came out to $500. So total. So I was just curious, how can I appeal or else, how can I appeal or ask Delta Dental why they don't cover certain things? Is there a way of?
Well, there are certain things that are excluded, definitely, especially when it comes to anesthesia. Do you have an 800 or 888 number for the PPO plan?
Yes.
Those are the people then that you would want to call. That
So
goes
I
right.
can call and ask about
Yes,
whatever, and I'll look
absolutely.
up the particular thing. It wasn't, this is described on the claim, but he used the
If
particular.
you have that code, you can give it to them right over the phone.
Yeah,
and
I
they'll
have
be-
the code. Is that the thing in parentheses?
It should say like
It says
8475 or
67
something.
or something like
Yeah.
that.
Yeah,
Okay.
they'll be able to tell you right over the phone if it was covered or if it's excluded. Absolutely.
Okay, it all had to do with that same tooth that the HMO screwed up, and I don't even know for sure whether there was even a cavity there. I mean,
Yep,
it was
I
just
get it.
so traumatic and stuff. I mean, I did go to the office, I selected, I had a dentist, and then
Yeah.
she left or something, and then I got this other person, and it was like, the dental hygienist was great in that office.
I'm so sorry.
But the dentist, so that's why I switched. I went and paid out of pocket to a friend of mine for the lady that was asking, Susan Patton, that was asking how to choose. I mean, when you said word of mouth, it is great. I mean, this particular, the office lady that's married to the dentist happened to grow up on my street 50 years ago. So I knew about that. And I also have a church friend that works at, but they were both under PPO. I only went with HMO originally because all I had ever had was cleanings. I never had any problems. So anyway, that's my question. I'm so sorry about my dog barking. I'm sorry.
It's okay.
She probably has to go to the back.
Doggy Dell, what is your name? I can't hear you. You're muted.
It's SELLS. It's Heather Sells. In the chat, I wrote from Heather Sells, SELLS.
Okay.
Like you sell something, only plural.
Okay, so
Okay.
we'll look you up and get back in
Yeah.
touch with you to provide some assistance.
Okay,
Yeah.
Alex,
And
I'll,
Thank you.
I'll
I'm
contact
sorry to be
her
so
as soon as
involved
this
and
is
take
over.
up so much time, but
It's
maybe
quite
other
all right.
people,
That's what we're here
maybe other
for.
people have the same experience.
Entirely possible.
Thank you.
All right, we're going to move on to Desmond, who's had his hand up for a while. Desmond, feel free to unmute yourself. I'm going to ask you to unmute. Are you with us?
I'm sorry, I don't have any question.
No,
No more questions? No more questions?
No question at all. Sorry.
Okay. Thank you, sir.
Thank you, Desmond.
Next, we're going to call on Jeanette Allen. And
My question was not relevant to this. I asked the question too early. I should have. I didn't realize that talking about, well, never mind. That's how it goes. Thanks.
okay, you're very welcome. Next up, we're going to open up the question to William. William, William Jensen, I'm going to unmute you. You can locate your audio button. Hi, William.
Hi, I was just wondering about the discount LASIX. Is that across all the Delta plans, PPO and?
Yes. Yeah. Doesn't matter which plan you're on, you are entitled to use that discount plan. Yes.
LASIX?
That's it. Thank you.
Yes.
That's
Good. Thank you, William. Mhm.
Thank you so much. Next, we're going to move on to Bernadette Arzu. Bernadette, are you with us?
Yes, I am. In fact, Vi answered my question. I was verifying how many cleanings per year because I heard you said 2 cleanings on PPO, and my dentist I thought had said 4.
Yeah, we talked about that earlier, and that the slide said 2. There are 4. There's 2 periodontal cleanings allowed on the PPO plan. So your dentist was correct. Thank you, Bernadette.
Awesome.
Yeah.
Awesome. Great.
Thank you. Next up, we have Glenda. Are you with us, Glenda? I'm going to ask you to unmute. Locate your audio button.
Got it.
Hi, Glenda.
Hi. My main question was, when will my PPO, I'm switching from Delta Care USA to PPO. I've already filed the papers, and I wanted to know, when will it take effect? It's already been answered by V. Duong, who said they will notify me in 2 weeks before it does go into effect. My subsequent question is that at 82 years of age, I have a number of teeth that are going to have to be replaced either by dentures or by implants. Now, that $2,000 limit for me with either one, that's all they're going to pay for it. Is that correct?
That is correct. And I can speak from personal experience because my husband is getting an implant done. A, they're expensive. And B, with the $2,000 annual maximum, that's probably going to cover one or barely one. You are correct.
Okay,
Yeah.
so what I'm going to do is I'm not going to wait for the PPO to go into effect. It's going to cost me more than $50,000. And that's aside from the question. But now my subsequent question is that periodically I need to have those implants cared for by my dentist, who is also a PPO provider. Consequently, will that be paid after the $2,000, I mean, before the $2,000 is up, during the year for care of those implants?
Well, if you've got money available on the $2,000, then yes, your dentist can file a claim. I'm not quite sure what the dentist needs to do.
Well, I understand that at least the first year, they are going to need to clean them and make sure that there is no disease underneath them, that they are implanted very well. Consequently, I do not know what that would cost. But I'm assuming that would you pay for the care of the implants after I have already had the implants?
Well, once, I could be mistaken, but I thought once they're in, they're in.
Well, yes, but the dentist, in fact, the oral surgeon said that they need to be checked and cleaned professionally at least once a year.
Oh, okay.
And my second question is, my PPO provider, the dentist that I'm planning on using, who is also one of your PPO providers, said that in order to make sure that she understands what the plan is, she's going to need a LASER's plan number for that. Can you provide me with that number?
I can. I have it right here in front of me. Do you have a pen handy?
I do. I'm ready for you.
Okay. It is group number 17228.
17228.
And that will allow her to call Delta and get those benefits.
So that way she can, I'm not a dentist, so she can explain what the aftercare is.
Yeah.
At any rate, since there's only a $2,000,
yeah,
there's only a $2,000 limit per year, I'm going to go ahead and have it done because I have a horror of dentures. I'm not going to go with dentures.
Yeah, I understand. It's a personal choice.
Exactly.
Implants are permanent. I get it.
They
just
are. And
very
even though I'm
costly.
82 years old, I'm also a foodie. I love food and I love good food. And I'm sick and tired of having the babies, these teeth that have, because thanks to dry mouth
Yeah.
and
Yep.
other issues, I have lost a lot of enamel and
Yes.
my teeth are literally eroding.
You're going to go for the long term. I get it.
I'm gonna go for whatever I've got left of life that I want to eat well.
Well, be optimistic long term.
Absolutely.
Yep.
Thank you for answering my question.
Glenda, I like your
So,
attitude. Thank you.
know, one strategy people do, and you probably already know this, is if they have a procedure that's going to cost a lot of money, they'll schedule it for the very end of the year, so that
Mhm.
part of it will be covered. The 2,000 will be spent, and then the new 2,000 picks up right away in the new year. So in that window, you actually have $4,000, which
Yeah.
could help a little.
Yes.
Thank you.
Definitely.
We have a hand up. We are going to move on to Faith Mock. You with
Hey,
us?
Faith.
Hey, Alex. I have a question because I know a lot of things they cover, a lot of things they also not covering. Question I have in regarding the Glenda was asking about the implant. Implant, I know implant they cover 50%. But a lot of time inside your mouth when you get older, your bone is not as good as when you're young. However, in the implant procedure, bone graft is not included in your coverage and not covered even one time. And I'm kind of wondering, perhaps, because it's when we are all retired, you are not getting younger. You are going, going to reverse. It's not really you're going to be getting bone more stronger than before. So how come bone graft was not covered? And bone graft is not cheap either by itself.
No.
So I'm kind of wondering, is something when we negotiate, looking at what kind of coverage they have, perhaps, I know good teeth cleaning is very basic. You need it, it's very good. A lot of time when we take good care of teeth, you only go through the teeth cleaning, all that stuff. Your 2,000, you're not going to go to use it all up, which is a good thing. But the same thing is we cannot carry over for next year. You don't use it, you lost it. So what happened is every year you only have 2,000. Previous 2,000, if you're only using teeth cleaning, you cannot carry over. That's the game. That is the contract we negotiate. That's fine. But I'm thinking about it. Perhaps you might want to look at something is more useful for the retiree. That's why I was looking. I say, how come? It caught me by surprise is when they say bone graft is not. But if your bone is not strong, it's not strong enough, you cannot do either one of them. You cannot do, implant. You cannot, even you do bridge, you still have a problem with it. That's something maybe when we negotiate, perhaps we should look into that. What kind of coverage they have.
Yeah, Faith, that's one of the reasons I really appreciate having these meetings and having members that are willing to come into these meetings and share their experiences. The periodontal cleaning, that was something that we added because members brought that up, that, we did more research into it. We see that most seniors, a lot of seniors, I should say, not necessarily most, but a lot of seniors require periodontal. It's not like you have an option. Once you have a periodontal cleaning, you always have to have periodontal cleaning. So we added that benefit. Same with implants. We did some research on it. People wanted it. And we saw that even though the short-term costs are more expensive, the long-term costs fare better than dentures. And so we went with that. And it's been a little while since we reviewed the benefits and, looked into adding benefits or expanding them. So, that's definitely something we can look at. We can talk with our consultants. We can talk with Delta and see what other options there are to help provide more support, because, our people are living longer. That's a good thing about medical care. But, as you mentioned, things don't always stay as well, as strong as they were, and we need more support as well. So definitely that's something I will bring up and we can look more into.
Greatly appreciate it. Second question I have for you is I know we don't have 2,000 like Glada was talking about, even does not even cover. Really, when you have problem, even one implant is not going to be covered one implant. I can tell you that already, because I'm in process doing it. I do exactly what you're talking about. End of the year, beginning of the year, you try to do whatever you can, but you only still can cover 1 or 1.5 teeth. It does not work out that very well. So do we have any kind of, I know when you're active member, we do have like a health, like supplemental, plan, like you buy extra can cover for this kind of situation happen, which is some tax benefit. I know retiree, so far, I have not find any way to be able to exercise that kind of supplemental, insurances in especially for dental, this kind, health, we are pretty decent, but a dental, when you touch it, it's not enough. 2000 really, I mean, at this stage is really not enough at all. So it's something we can look into it and see if we can have that option existing for the employee willing to go for it.
Yeah.
A couple of things, if I may interject. I had to text the account manager only because I know, I said my husband is having an implant done also. Delta Dental excludes bone grafting with an implant, period. So that's just something that's not going to be covered, unfortunately. I had to confirm that. And then the $2,000 maximum in network is actually a very generous benefit. Most of our plans standard are $1,500. So I just wanted to add that. I always like to tell people that have a higher than average annual maximum that the $2,000 is very generous. It is higher than average. And I do agree there are not a lot of supplemental dental out there that you're not going to pay, you're not going to have a lower monthly premium that is not going to add up annually to what you're paying for what you're getting done. But when you're running into implants, it's just a very expensive procedure. That's really all I can offer on that.
Yeah, I know, just thinking about my parents' dental insurance, they have it wrapped into their Medicare Advantage plan, and it really only covers preventive services. It doesn't cover anything hardly.
Pretty much.
Yeah. And it's sad, really. I mean, it's not, it's not Julie's fault. It's not my fault, but, just the way the industry is. And, I do think that it's something that hopefully will improve, because as we know, the baby boomers are, retiring. We're seeing more people living longer, and we need care, so. But we'll see what we can do, Faith. We're always, happy to hear from our members again, and that kind of reignites our thought processes and draws our attention to the needs of our members. And so we'll definitely work with Delta in the coming year and see what other options we might have to help improve the benefits and the associated costs. The board has to make that decision, and if we're able to improve the plan and we find that it's cost effective to do that, I know that the board will support that.
Yeah.
Thank you.
Thank you, Faith, for all of that feedback. Also appreciate it.
We have another question here. We're going to move on to Bernice. Bernice, I'm going to ask you to unmute, and please go ahead.
Back to my copay. Is there a copay for PPOs at all? Because I'm looking at the chart here and it said 80%. What is that referring to? 80% of what?
That's
yeah.
I was just going to say, she's showing everybody page 50 of the 2021 Health Benefits Guide.
Yeah, 80%. Is that for copay?
Well, go ahead. Look, I'm jumping in.
Well, it's fine. I mean, I'll say something, and Julie or Crystal can, add to it if they feel they need to. But basically, the insurance company, they, with their contracted providers, they agree that there will be a certain fee for a service. And so, when you go in to get that service, the plan here, if it says 100%, the plan will cover 100% of that cost. If it says 50%, the plan will cover 50%, and then you have to pay the balance of the other 50%.
Right. So Bernice,
whatever. So there is no copay.
It's called co-insurance, and it's basically you know, the PPO, you have the wonderful flexibility and freedom to go where you want, but then it's a lot more complicated. I don't like it personally. It's like, I don't need to I don't want to make decisions, but you know, it's like, yeah, there's a set cost. I mean, you can talk to the dentist to know exactly what your cost is up front before you do the procedure, but
I mean, just for a regular cleaning, you have to pay a 80% copay just for
No, for a regular clean, she's talking about a regular cleaning, Alex. Is that just the basic cleaning or periodontal? Because I believe the benefit is covered at 100% now.
It is.
Now, but now if you're looking at non-network, Bernice, are you in the non-network column?
I'm not sure. It says PPO, and then it comes down and it says where basic services, and then it lists them. And then I'm looking for fillings and extraction, 80%, whereas the other one for copay is 100% under, which I've been under for HMO. There's never any copay. But now I want to switch to PPO, and it's saying like 80% for.
Okay, so you're comparing the HMO to the PPO. Under the HMO plan, your cleanings are covered at zero. You pay a zero copayment.
Right.
If you switch over to the PPO plan, you don't have those set copayments. You're going to be paying a percentage of the bill when you go to the dentist. That's what. So the percentages shown are what Delta pays. You're going to pay the remaining percentage when you go in. Yeah, it's a little, it's confusing.
Okay, got it now.
But what you're going to get by going on that PPO plan, and that's probably why you're switching, is maybe you're looking for the flexibility to go to any dentist.
Right. Exactly.
That's what I'm thinking. Yeah.
Yeah.
Got it.
Thank you.
All right. Thank you, Bernice, for your question. Our next question is going to be from, we're almost catching up here, from Debbie. Debbie N. I'm going to unmute you and please go right ahead.
Hi, I just had a question. My dental office was closed for most of 2020 as most people's due to COVID. Can Delta Dental extend the unused annual maximum into 2021 since we weren't able to go and didn't use it? Now that they're open, I tried to make an appointment and they don't have anything until next year just because of the COVID guidelines.
I don't know if you were going to speak, Alex, but I don't know when exactly they opened, but we did find that most of the dental offices have been open for quite a while. So I don't know if they just opened, but I know a lot of them had opened as of June, July. So
yeah, I think I was going to say, I know, you know, different dentists have different situations. Like I went to go get my teeth cleaned recently, and my dentist said he may not be there for my next cleaning because unfortunately with the pandemic, he wasn't able to see patients, so he wasn't earning income, but the landlord is still charging rent, and he has to not only start paying that rent, but also the back rent, and he just isn't, his business isn't back to normal yet. So he said he may just have to retire. So I know other people that have experienced that as well. That's just something for everybody to keep in mind if you haven't talked to your dentist lately. But the benefit doesn't roll over. I'm sorry, I was scrolling through the other questions when you asked, I'm sorry. But you were asking if the 2,000 will roll over since you didn't get the opportunity to go to the, it doesn't roll over, I'm sorry.
Yeah, I'm sorry also.
Okay. We have another question. We have a hand up here from an iPhone, and we don't have a name. So if you see the audio button, please introduce yourself and go right ahead. You have a question there on an iPhone? I think no more question from the iPhone. I got a hand wave. So we're going to lower the hand. All right, next up, our next question is from William. William, I'm going to ask you to unmute yourself in just one moment. Mr. William Jensen, please unmute yourself and please go ahead. With us there, William?
I see him.
I see him. Yeah, he's coming along.
I already asked my question about the LASIKs.
All right. Thank you, William. So then our next question is going to be from Nancy. Nancy Castles. I'm going to unmute you right now.
Okay.
Hi, Nancy.
I have had a similar question to Faith Mock, and I'd like to second everything that she said. My question was, there was a comparison of costs for given for PPO and the non-PPO dentists, but not the comparison costs for the PPO versus the HMO. I know it's on page 50, but what didn't make sense to me was that for things like fillings, extractions, and the root canals, the HMO paid 100% and just had to pay the copay. But under the PPO, which is supposed to be a better plan, you don't pay the copay, but you pay 80%. I mean, but we would have to pay 20% of, Delta Dental for the PPO pays 80%, whereas the HMO paid 100%. If the PPO is a better plan, and that's what I thought it was supposed to be, certainly when it comes to the issues that we have as we go over, like implants and crowns and stuff, it struck me that if the PPO is a better plan, why are we paying 20% and Delta paying 80%, but the HMO is paying 100% for everything, for those particular cases like fillings and extractions and the root canals?
Oh, can I just answer this, Julie, before
Yeah,
you?
and I'll jump in if I need to. Yeah.
Okay, Nancy, Delta Care has what's called a summary of benefits page, which has all of the procedure codes and the copays for any dental work that they do. And so basically, you mentioned getting a root canal done, right, or getting crowns. Well, in our book, we're just providing you with a basic summary. So where it says the copay is covered at 100%, that's the copay, but that does not include the lab fees. Okay, there's a $75 charge per tooth when you get crowns and things like that. There are additional charges sometimes with an HMO. Our book is only providing you with the summary where you're going to get the true cost of what's being done with an HMO. You have to get the summary of benefits that I believe we had those in our office at one point in time. So there are other charges besides a copay, and just like I used to have members that would contact me when you're getting porcelain crowns that's made out of different materials, that's considered cosmetic. So even with an HMO plan, a porcelain crown is not going to be covered. That's considered cosmetic. So even with the PPO, it may not be covered. With an HMO, it's not going to be covered. So you really have to get the summary of benefits page, which you can request or maybe can get it up from their website. And then that's going to show you in detail what's covered with an HMO versus the PPO. And really and truly, the differences in the plans is the flexibility of it. Right. Now, if you're a person that travels to different states and go different places, a PPO may be more flexible for you because you're going different places, and you need the ability to use your benefits out of state in other places. So that's why I just wanted, and she just pulled it up. Take it away, Julie, because then you can, hit on it. Or maybe
actually,
that's Alex. Okay.
I don't have that.
Everybody know on our website, if you go to retirees and then under health benefits, we have evidence of coverage, and under dental, we have Dental Care California, that's the HMO, and Nevada, and then for PPO here, and it gives you a lot of details about the plan. I'll just click on this real quick. And then I do want to also mention just HMO and PPO are just totally different animals. I mean, it's the same thing with the medical plans. You pay, it costs less to have an HMO because you have a primary care physician. That's the only one you're seeing. There's not a lot of claims that have to be adjudicated and administered. So they don't have that same additional cost. And with the PPO, it's just, there's a lot more work behind the scenes to do that. And there is the flexibility and people just pay more for that. Unfortunately, I don't know if it's right or wrong. But some people want that and it's important. But this is an example of what you can find on our website. Yeah, so it talks about everything, the benefits, the different definitions. So just going back up to the table of contents.
Right, the evidence of coverage.
Care, benefits, limitations, and exclusions, co-payments and other charges, emergency services, urgent services, specialist services, second opinions, claims. So you can find all that on our website. Again, just go to our website, lacers.org, click on retirees and then health benefits. And then at the bottom of the list here on the left side, you'll see evidence of coverage, and that will take you there.
Okay, but in general, I mean, when it was presented a long time ago, in general, it was told that going to a PPO plan gave the employee or the retiree better benefits or better coverage in terms of less costs when one of these more complicated procedures occurred. So you're saying that may not be the case?
Well,
I mean,
no.
it all depends. I'm not 100% sure the specific services that are covered between the HMO and PPO, if they're exactly the same or not. But with an HMO plan, you're just going to pay a copay, like $25, whatever it is, $50, it depends. And then that's it. With the PPO, you're going to pay a percentage of the cost, which can end up being more. And, honestly, I think a lot of people think the PPO is better because a lot of dentists that go into the PPO, not the HMO, they're going to make more money.
Yes.
Doing the PPO. So they're going there. And, so I think a lot of people feel like they're going to get better care. But, I don't know, the HMO, they just get a set amount and that's it. And so some people think that maybe they're not as good. But really, I always think it comes down to your doctor, your dentist. You find somebody you really like and you trust. That's the most important thing. My dentist I've had my whole career with the city. He was originally in the HMO. He then we went to the PPO. I switched to the PPO to keep him. And he's great. And, I've been with him for 30 years. So,
Yeah, see, and that's what happened to me. Mine switched from HMO to PPO, and then all of a sudden it seems like, gee, I seem to be writing bigger checks. It just used to be the copays, but now I'm writing checks. I mean, big checks. So, and I just thought it was a matter of age. I needed better, more complicated stuff, but I can see then why they're saying, why the dentists would indicate now that, it's recommend that we stay with the PPO. Okay, I have a little bit better understanding of that now. Thank you.
Thank you very much. We are now going to move on to the iPhone again. I'm going to ask you to unmute, and if you are ready, your iPhone without a name. We still don't hear you here. It says you're unmuted. And is there a possible way to unmute?
Is the
Yeah, it was,
question
there they go. It's owner's iPhone.
Yeah, I'm trying to get her.
There you go.
She's unmuted, but we can't hear. There must be a speaker issue on your end, ma'am. And I'll ask you to contact me after the meeting and I can help you fix that. Please put your question in the chat.
Is the question in the chat?
Yes, please put your question in the chat. Okay, we have another question while we're organizing that with our iPhone. And our next, well, look where there, who's left? Then we have Debbie. Have we called on Debbie? Debbie N. I'm going to ask to unmute you, Debbie.
Yes, you answered my question earlier. Thank you very much.
Thank you. So I think that was, we do have one more, Charles. Are you with us, Charles? Looks like Charles might have left the meeting. So I guess with that, we're pretty caught up. And I also explain how all your questions will be answered via the website and through Lacers. And I'll pass you to Alex, Stephanie, and Crystal.
Okay, well, we do have a couple raffle prizes, compliments of Delta Dental. So we're very excited about that. But before I get to that, I just want to say Elijah is always here to help our members. We have him on contract. He's required to help you, darn it. So if you need to contact him, Elijah, would you give your phone number?
My toll-free number is 800-281-0692. Just say that you're from Lacers and you get right directly to the front of the line. And there's a couple with any issues, small or large, no question too small, really.
And if you can put that in chat as well, that would be appreciated. And then they could also email you, right, at help@momscomputer.com.
That is correct. And I will put that in the chat as well.
Okay.
And please call, don't hesitate. There's so many things that can be resolved and make your day so much easier.
Yes, so I just want to say thank you to everybody. It's been a great meeting, a lot of questions, a lot of interest. Actually, this is probably one of the more interactive open enrollment Zoom meetings we've had. So it's really good. Hopefully you find it worthwhile. So before we say adieu, or bid adieu, as they say, we want to give the raffle prizes out. So we have two electric toothbrushes. Julie, did you want to say anything about them real quick?
I will just tell you that they are a Philips sonic toothbrush, and they're quite lovely. I wish I had a picture of them, but I don't. And what we will do is we have them in our fulfillment center. So they will be sent out to you via UPS. So good luck to everybody. I think you'll like them when you receive them, the winners.
So if you're the winner, then we'll want to make sure we have your correct name. So don't say, yay, I won and leave. So hang on till the end. And what we're going to do is we're going to have you pick a number between 1 and 200 and put that in the chat. And I already wrote one down in here, and I'm going to set it up here so you know I am not changing the numbers to give favor to anybody. And then we'll give you a couple minutes to do that. And then we will unveil the number and find the winners. But you're all winners. You're all Lacers retirees. So between 1 and 200. So just go to the chat. Click on it, write your number in. I'll give you a couple minutes. I know it's a big decision. I can tell you right now, I saw one with the exact number and one very close. Oh, somebody is putting theirs a 156 for Balber. Okay, we've got that written down. Yeah, if you don't know how to use the chat, if you want, you can write it on a piece of paper and hold it up to the screen so that we can see it. But is there anybody else at this point who hasn't put in a number? Just gonna go quickly through. All right. I'll give you 10 more seconds just in case. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And the number is 173. And I see that Doggy Dell got that number. Yay. All right, Doggy Dell. Doggy Dell is hot today. And then
Yeah,
I
that's
think
me.
there was a 175 as well.
There was, yeah. Yeah, Doggy Dell is really,
And Al, is there a 174 or a 172?
175 is Gina, it says.
Oh, maybe there's
Gina
two.
Lynn is 175, it says.
Oh, there's one at the bottom as well. There's two 175s. We're going to have a runoff. All right. Let's see. Just making sure there's no 174s or 172s. Nope. Okay. So now we have to have a runoff. So we will do this again, but I'll make it really simple. Between 1 and 20. Don't want it to be too easy.
You know what, Alex? It looks like that 175 is the same person.
Oh, is it?
It looks like it.
Oh, I see. Al, it says Gina Lynn 175. Okay, I see. All right, is that right?
Can Al unmute yourself?
Okay, Al and Gina Lynn are together. They're
Oh,
together.
okay. I
Yeah, they're
see.
together
Okay.
there.
Okay. Well, then that's it. Then you two, Doggy Dell and Al or Gina, please stay on at the end so we can get your name and contact information. And your wonderful electric toothbrush will be mailed to you by Delta. I don't know, Stephanie, Crystal, any parting words?
Okay, go ahead, Stephanie. Are we going to do the exercise or no?
Oh, that's right. Oh my gosh, I completely forgot.
No, we're not going to do the exercise. We've already kept everyone too late as it is. So sorry about that, everyone. But your questions are actually more important. So we wanted to make sure that you all got your questions answered. Really appreciate you taking the time. I did put a link in the chat function. I'll put it again for you to complete our survey. We would really love for you to give us your feedback regarding your experience here today. And just really looking forward to seeing you all at our next event. We do have, I believe, Blue Vision. Am I saying that right? Blue View.
Blue View.
Blue View up next week. And I did mention the virtual holiday events that the wellness program has planned for you. Looking forward to seeing you there. So, and then champion program, we could really use your help, more champions. So I did put a link there, or you can reach out to myself or Crystal via email at lacerswell@lacers.org. I'll put that in the chat as well. So I'll give it back to Crystal or Alex.
Well, I was just going to say, you know, on our shorter open enrollment meetings, we did end with a quick little 5-minute video compliments of Silver Sneakers or Silver and Fit, just as a way to promote those programs that are available to you through our health plans. So please, please, please take advantage. It's free gym membership when we can go back to gyms. But at home now, there's all kinds of great video online opportunities to, you know, work with an instructor and, you know, do some exercises and stay fit. So it's a free program, part of your medical coverage. So please take advantage of it. And with that, just have a wonderful day, and it's great seeing you.